Hello again. This will be a fairly short lecture on Dan Brock's piece, Conscientious Refusal by Physicians and Pharmacists, Who's Obligated to Do What and Why. This is an especially controversial topic. An example of it right from Wisconsin some years back. Now, I think within the last 10 years, a pharmacist, customer of a pharmacist presented a prescription for a morning after contraceptive, and the pharmacist refused to fill it and also refused to return the prescription to the customer on the grounds that the mechanism of the morning after contraceptive is basically an extremely early stage abortion. So the issue is, do professionals have a right to refuse to provide service on the basis of conscience? We haven't talked about conscience very much, and we're not. We mentioned early, I think the first day of the course, that there are two kinds of moral conflict. One is to get oneself to do what one knows to be right already, and the other is actually or rather, two kinds of moral problems. Yeah, the first is to get yourself to do what you know to be right, and the second is to determine what the right thing is. Conscience is closer to the first sort of situation. It's not a conflict so much, although there certainly is instances of conflict with one's conscience. But conscience requires knowing or believing what is right and wrong. So it's really outside of our concerns. But here it is, and it's an important sort of problem. And it points us back to what the role of professions is in society. So what is conscience? Brock understands it as an individual's faculty for making moral judgments, together with a commitment to acting on them. He allows that there's a problem of the epistemic status of actions proceeding from exercise of conscience. That is, epistemic status, that is, whether something is whether one is justified in one's beliefs. This is in epistemology and in immorality. We can allow, with respect to conscience, that somebody can believe that action A is right, and somebody else believe that action A is wrong, and both be justified in their beliefs. Yet they can't both be right. That we can be justified in believing something that's untrue or wrong. He distinguishes between religious and secular consciences. That there can be variance among people with religious conscience, just as there can be for secular consciences. Now, if what one's conscience tells one to do need not be right, then if we allow that, what is the moral basis for the claim that individuals ought never to act contrary to conscience? It is possible then for your conscience to tell you to do something that one believes is right, but it's actually wrong. It can be shown to be wrong. Then what is the value of acting on the basis of conscience when what your conscience tells you to do turns out to be wrong? Brock says at this point one might make an appeal to integrity. That is, standing for what one believes in. We said that conscience involves both a belief in what's right and acting on the basis of one's belief. That implies integrity, that one stands for one's values, that one tries to act in accord with what one believes to be right. But valuing and respecting one's own integrity is grounds for respecting the integrity of others. That would certainly fall right out of Kant's thinking. One problem is that integrity can conflict with other moral requirements, and this is particularly the problem that professionals face. He gives us two examples. Dr. A has deeply held religious and moral beliefs that the mixing of the races is wrong. In particular, he believes that white doctors should treat white patients and that black patients should be treated by black doctors. He refuses to accept black patients in his practice. Dr. A is a renal specialist and spends 2 days a week in a hospital renal clinic seeing patients with end-stage renal disease, and here too he refuses to see black patients. Dr. B is an emergency medicine physician who has long been on staff in the emergency department of a large urban hospital. She recently converted to the Jehovah's Witness religion and now believes that transfusing a patient would threaten the patient's salvation and constitute a grave act of disobedience to God. As a result, she now refuses on grounds of conscience to transfuse any patients in the ER in which she works. Now, what's the difference between these two cases? Dr. A is a racist, and racism is illegal and morally wrong. That's enough to indicate that Dr. A is not justified in refusing to extend his practice. Dr. B is in a particular medical specialty where transfusion is common. Now, she entered her specialty before converting to being a Jehovah's Witness. But now, in her role, transfusion is a common medical procedure. So in Dr. A, it's purely a morally unjustified belief that he has. In the second case, Dr. B, fine that she has her particular religious belief, but it conflicts with her professional role in a particular way. Brock discusses an argument for the justification of coercion without interference with the coerced person's conscience. That is, if one enters a profession, then it's part of being a profession, generally, that the profession has a monopoly on that service. That to provide medical service, you must be a licensed physician in particular. So if you're a member of a group that has a monopoly, then it follows that you have an obligation to provide the service, or to make sure that a colleague does, if one is either unable or unwilling to provide the service oneself. So this is, Brock first makes the argument that the society is justified in coercing professionals to provide a service. And because you're coercing them, because you're forcing them, this does not conflict with their conscience. It's possible to do that. So he says, should Dr. A or B act against conscience and do what he or she thinks is wrong? No. It means that society can sometimes legitimately use coercive measures, if necessary, that interfere with one of its members acting without interference on his conscience. It means that society could legitimately require its members to act in a way that some of them believe to be wrong. No absolute moral claim or right to act on one's conscience without interference from others is sustainable. At this point, he introduces what he calls the conventional compromise. That is, what are professionals of genuine conscience who are in a professional role that would require them to provide services that their conscience requires that they not provide. There is an out, to the extent that it is, Brock allows. So there are three conditions of the conventional compromise. This provides conditions under which conscientious refusal to provide professional service is compatible with one's professional obligation. First, the professional must inform clients about the service if it is relevant in the client's case. Second, the professional refers the client to a colleague. And third, the referral does not impose an unreasonable burden on the client. All three of these conditions require some planning in advance, some reflection. If a professional whose conscience will interfere with providing professional services that are generally available, that are accepted, that are part of that profession's practice as acknowledged by its members generally, then there is reason, there's an obligation for the professional in advance to think about these conditions and how they can be satisfied. The refusal is not always justified, even if the conditions are met, he allows. Consider the racist physician earlier. It's simply wrong to be a racist. You're not justified in refusing to provide services because you're a racist. And also the Jehovah's Witness ER physician, that in that particular specialty, it's vital, literally, that patients receive blood transfusions. If you want to be a physician and a Jehovah's Witness, be a radiologist or a pathologist, perhaps. The first condition, that the professional inform the client about the service if it is relevant to the client's case, may require informing clients in advance of what services would be provided. That is, when a physician would first take on a patient, it might be necessary to inform the patient of your moral religious beliefs and what will happen, that you will get the service under these conditions will be fulfilled for you. The second condition of making a referral requires professionals to become aware of which professionals in the vicinity are willing to provide the services in question. So if you are employed by a hospital or a particular healthcare affiliation, then you may have to do a little work to find out which physicians are willing to provide the service that you yourself are not. The third condition, like the first, is vague. That is, when is it too burdensome? There may be reason at the beginning of a professional's practice and subsequently to try to anticipate those. So what he has in mind here is where can the service be provided? Do you have to? This is happening in reality now with abortion services in Texas. There are very few clinics available for abortion in Texas any longer, only because the Texas legislature has made it so onerous to provide abortions that most physicians simply aren't able to. If you are able to, if your clinic is able to perform this service and it would require sending the patient 100 miles or more elsewhere, there's an opportunity to reflect on that in advance and make accommodations for it. The conventional compromise is an attempt to balance the requirements of conscience then with other moral obligations. Brock notes that states could require professionals to provide the services in question regardless of a professional's conscience. That's the deal that the profession makes with the state. And if one is going to be a member of that profession, that's the requirement of it. Does a conventional compromise make the conscientious professional complicit in the practices to which she objects? Brock allows yes, but she voluntarily entered a profession having a monopoly on those services which society collectively believes right to be provided. What if the services in question were not available at the beginning of a given professional's career? say, a physician opposed to abortion who entered the profession in the years before Roe v. Wade, or a teacher who is who believes, well, he's a racist, again, and refuses to teach Black children. Entered teaching before Brown versus Board of Education. When in those days, before Brown versus Board of Education, segregation was legal. Brown versus Board of Education made it illegal. Well, things change, Brock says. Responsibilities change with the evolution of professional practice, and that is the relationship of the profession to society. Is Brock concerned with consulting or scholarly professions, as we made that distinction? Probably mainly consulting, but he does consider briefly a pharmacist who's employed by a pharmacy. Their conditions he discusses pose no problem. He allows that the pharmacy could always make sure that a second pharmacist is also working or on call. He also considers a physician who is whose religion requires not working on Saturday. That's not a particularly onerous condition that a hospital should be able to schedule somebody else on Saturdays. But other circumstances may be too onerous, in which case a pharmacy or a hospital, say, could require a professional if they are to be employed there to provide the service. There are very few issues in the course that I'll voice my stand on, but this one, I'm quite sure that Brock is right here, that it is part of being a profession, as we said, that the profession have a monopoly on a particular service. So if if someone is a member of that profession, then there is an obligation to provide the service or to use the conventional compromise that he provides. Is one complicit in the action that one's conscience tells one not to do? Yes, to that extent. But then one can choose another line of work.